Good afternoon. Thank you for joining us today for the AGA webinar on how sequestration will affect research funding. I'm Timothy Wong, Chair of the AGA Institute Research Policy Committee and Chief of the Division of Liver and Digestive Diseases at the Columbia University Medical Center. After a contentious election, the status quo remains in Washington, D.C., with President Obama remaining in the White House, the Democrats retaining control of the Senate, and the Republicans retaining control in the House. But there is a lot of work to be done even before the inauguration of new government officials in January. A budget battle of historic proportions faces Congress, including a staggering number of fiscal issues, such as stopping an 8% research funding cut that both political parties agreed to postpone until the post-election lame duck session of Congress. Time is running out, however, and Congress must act soon to avert a serious fiscal crisis. But how will this affect you as a GI researcher? Today we're going to hear from experts with Heart Health Strategies, a bipartisan consulting and lobbying firm specializing in legislative and regulatory healthcare issues, and a longtime partner of the AGA. Shanna Christup, Vice President of Health Policy at Heart Health Strategies, will explain to us the fiscal cliff and sequestration and the impact of funding cuts on research and other programs. We will also share AGA's position on the issue of funding cuts and the advocacy efforts that you can join us in to ensure GI research is being represented well in Congress. All questions will be answered at the end of the webinar. To ask a question, please type your question in the question pane. Shanna, can you please begin?
Happy to. Good morning or afternoon, everyone. The first slide I have here is just to kind of back up just a little bit to make sure you understand why we're here and why we're having this conversation. And really it's just a visual picture of how much we are spending more than we're bringing in taxes and other sorts of revenue. And especially if you look at that alternative fiscal scenario, it looks like it's going to continue to get worse and worse as time goes on. Next slide, please. And part of the reason I want to talk about that alternative fiscal scenario, it involves the extension of the Bush tax cuts, the alternative minimum tax being changed, the SGR, the sustainable growth rate, actually being updated with just a 0%, and that the sequestration does not occur. So it's all of these combination of things in this alternative fiscal scenario and all the things that Congress needs to do that's putting us to the brink of the fiscal cliff. So if Congress does not work to do these, this is kind of on Congress's to-do list or in the lame duck session. If it's not done, then that's sort of what everybody's been talking about, is that fiscal cliff issue that's been in the news and so forth. Next slide, please. Beyond the sequestration piece, which we'll go into a lot further in the slide deck, I also want to talk briefly about the sustainable growth rate formula. As you all are well aware, Medicare physician payments are due to drop by almost 30% in just 6 short weeks. That has a large cost of over $380 billion, and unfortunately right now there is no consensus on the SGR replacement. So let's get into that whole discussion of how we got here as far as sequestration. Next slide, please. As you recall, early last year we had to raise the debt ceiling, and there was lots of discussion about how to do that and what that meant. And in the end, next slide, the Budget Control Act was put into place. Now, the Budget Control Act did raise our debt ceiling, but it also put into place ways in which we would reduce overall spending over time. There was 2 different stages of cuts. The first stage would be cuts to discretionary spending only, irrespective of actions of the super committee, and this would be sort of like an ongoing budget for the next 10 years. And then the second one was sequestration or across-the-board cuts if the super committee did not act. Next slide. Going a little bit further into that first stage of cuts, it means it's new caps on discretionary spending. It was a total of $841 billion. And the better thing about this process is that Congress gets to decide how the spending gets allocated every year, so it can pick and choose programs as it goes along. And of course, if Congress goes above their caps, what happens is sequestration occurs or across-the-board cuts. Next slide, please. The other important thing to sort of keep in mind is discussing the first stage of cuts in the Budget Control Act is that there are different cuts based on the definition non-security versus security. Under this first stage, the security funding is broadly defined, including a variety of different entities. Next slide, please. Under sequestration, which is the cuts that would go into effect because the super committee failed, the super reality of the super committee was as it was, there's now a total of $1.2 billion cuts. So as you can see, that's a larger amount of cuts that's not determined by Congress. It's sort of across the board cuts, and it's imposed on discretionary and mandatory spending. In addition, the cuts are split evenly between defense and non-defense. Next slide, please. And the difference with the sequestration cuts when we start talking about defense, non-defense, is that that term is very narrowly defined, and that security funding is really just DOD. So this really means that the sequestration impact, at least for this period of time, is very, very steep. Next slide. How steep, you might want to know. And so I'm going to go through a couple of numbers and so the data that we do have right now. And going through those numbers, I want to step back first and give you some background of what those numbers mean and how I was able to pull them together and so forth. Some of the numbers we'll deal with today are from the Congressional Budget Office, or CBO. These are budget estimates, and its information is provided for fiscal year 12 through fiscal year 21. It's a longer time frame in which they looked at the numbers. But the important thing to remember is, per the Budget Control Act, the White House Office of Management and Budget, or OMB, will be ultimately deciding how much the cuts are and setting up those percentages. But unfortunately, at this point, the information from OMB is limited to the information in fiscal year 13 only. Let's look and see at the various numbers that have been provided by both CBO and OMB. Next slide. So as you can see, there's a little bit of variance as to what the numbers are and what they might end up being between the CBO and OMB numbers. Not massively. The part I would like to highlight, though, is both of them agree per the Budget Control Act that Medicare keeps just a 2% reduction per year. So on top of the SGR being hanging out there and hopefully getting fixed, but if it doesn't, you would see both the SGR cut as well as an additional 2% cut to physician payments. So let's go through a couple of examples that I've highlighted here. For instance, the security discretionary funding at the DOD, and then we'll also go through the CDC's colorectal cancer program. Next slide, please. So the DOD's peer-reviewed cancer research program was established in fiscal year 2009. It has a total of $16 million at that time. And for fiscal years 2010 through fiscal years 2012, it did include emphasis on colorectal cancer. So this has been a mechanism by which some researchers have received funds. Next slide, please. And CDC's colorectal cancer control program provides funds to 25 states and 4 tribes. And this is to really increase colorectal cancer screening among individuals aged 50 years and older. The fiscal year 2012 funding was $47 million. The fiscal year 13 President's request is unknown because of the request in total consolidated a lot of this program with a lot of other cancer prevention programs. Next slide. I also want to highlight some additional information we learned from the White House report or from the information from the Office of Management and Budget when they gave us the one-year information. The first is that the Food and Drug Administration user fees would be subject to sequestration. That's sort of would be considered atypical, but you may hear a little bit about that. The second one is that due to the transfer rule, the Agency for Healthcare Research and Quality funds would not be subject to sequestration. Now, that does not mean that AHRO, or the Agency for Healthcare Research and Quality, will not be affected by sequestration. It just means it depends on how Congress writes the appropriations law and funds that provides the funding to NIH that then gets transferred to AHRO. If it does it in such a way, what may end up happening is basically NIH has to absorb the cut that AHRO would have received. So that's why we like to highlight that now, or it may end up being that AHRO, then, if it's written this another way, it would mean that AHRO would then receive the cut but not directly in its account. It would be after it was transferred. The other interesting component was that the Some of the CDC funds at the funding at the Centers for Disease Control and Prevention were tagged as defense programs versus non-defense, where we think of most of the activities at the Health and Human Services. And so therefore, it actually was subject to a higher percentage cut than some of the other programs. And this also was a reminder that per the Budget Control Act, all funds for the Veterans Health Administration, the Veterans Administration, both discretionary and mandatory, are exempt from sequestration, including a program gastroenterologists, GIs often follow the VA's medical and prosthetic research program. Next slide, please. So before we move on, I want to just kind of do a summary slide of what we're talking about and what happened in the first stage, which is the VCA cuts, the second stage, the supercommittee sequestration, and what that means total. So for Medicaid, S-CHIP, Social Security benefits, and so forth, under the first stage, no cuts because the VCA cuts in the first stage are only to discretionary programs, and those are mandatory programs. And the supercommittee sequestration, there were no cuts because they were exempted, so therefore those programs are not affected at all by any of these discussions. On Medicare, again, first stage mandatory programs, so there were no cuts. For the supercommittee sequestration, there were 2 cuts per year. It's a special rule, therefore it would be a total of 2 cuts per year, 2% per year. And then as you can see, for the discretionary non-defense programs, there are cuts under BCA, there are cuts under the supercommittee sequestration, and that ends up being a cumulative effect of nearly 20% decrease in funding for those programs, and a very similar numbers for whether you're defense or non-defense, but I wanted to make sure you could see those numbers, sort of together on one slide. Next slide, please. And this is just sort of visual graphic representation of the non-defense. This would be kind of like how NIH would be perceived, and the cuts that would be projected based on, again, CBO's numbers. And I want to highlight a couple of things on top of that. So as you can see, the sequestration happens no matter what. So the red line would occur, the 8.5% cuts would be there. Under CBO's projections, NIH should have received a 4% decrease in funding, but as we know, at least so far, as up until the end of March, per the recent appropriations bill, NIH was just flatlined. So this is where I kind of want to highlight the fact that the advantage of the first stage of cuts is that Congress can pick and choose what programs get whacked harder or less hard, as the case may be. And Congress has opted so far to sort of spare NIH those 4% cuts. But Congress can do nothing unless it acts to deal with that fiscal cliff to stave off the 8.5% cuts. Next slide. And this is a similar kind of slide looking a little bit at the defense numbers. It's interesting that although they still end up getting a similar percentage, nearly 18% reduction over the time period, you can see some of them decrease and increase depending on which programs you're looking at. Next slide. So this AAAS has put together some slides and looking at what does this really mean if we look under, again, BCA cap, which is that first stage of cuts, or under sequestration, and then they actually have a third proposal. Various individuals have come forward and said, it's not really appropriate for defense to take that quite a big of a hit, so therefore what we should do is sort of even that out a little bit more and apply more reductions to the non-defense programs. So if that was the case, you could see those. So even under the BCA caps, which no one is currently discussing changing at this point, you could see NIH actually just kind of being flatlined for the next several years. Under sequestration, again, that would go into effect if Congress does not act during the lame duck session. You can see quite some reductions, and then again, if you look at the defense versus non-defense issues, you even see more reductions. Next slide. And here's a similar kind of piece for the DoD R&D funding. Again, you can see under the BCA caps, it would just sort of be a pretty much level funding for the upcoming years, and under sequestration, you would see quite a large reduction. Next slide. So why don't I want to say to this, you kind of look at these numbers and you go, well, why would you ever do that? And the answer is, it was never intended to be implemented. as highlighted by this slide, President Obama came forward and said, you know, remember this is supposed to be the hammer that kept the super committee at the table and made sure it happened. And unfortunately, the super committee was unable to move forward, and so this is really bad policy being implemented, and hopefully it won't. So let me, next slide. I want to just highlight a little bit more the impact that this would have on NIH, since a large portion of your research funding probably comes from there. So we've discussed that there would be a cut of 8.2% in fiscal year 2013, and that cut is $2.5 billion plus or minus a little bit. I want to make sure you understand that that is the amount that NIAID spent on fiscal year 2011 external grant funding. And that amount that's being cut is half of NCI, National Cancer Institute's budget. And given that NCI is the largest of NIH's 27 institutes and centers, I mean, it kind of gives you an idea of just how large of a reduction you're talking about. There's estimates that that would mean that it would be roughly 2,300 fewer grants, 25% of the, only 25% of the newer competing grants would receive funding, and that translates to a projected success rate of 14%. And that's quite a big reduction from 21% in 2010. Next slide, please. So I hope you understand that, you know, unfortunately there's a lot to do during the lame duck session, a lot going on, and as this sort of cartoon depicts, it is a mess at this point, and we're hoping that the grand bargain is available. Next slide. But what happens if Congress is not able to act and figure out how to sort of deal with this fiscal cliff that includes the sequestration? Well, CBO has estimated that real inflation-adjusted GDP would drop by 0.5%, and unemployment rate would rise to 9.1%. So you can see that it has large impacts for the overall economy. Next slide, and now I will turn it over to our first speaker.
Thank you, Shanna, for that informative presentation. It's hard to imagine how each of us is going to be affected by these massive funding cuts. Unfortunately, the cuts will cripple laboratories across the country and hinder medical research. America is a leader in medical research and needs to continue to be one. Funding for research not only improves the quality of life for countless Americans, but breeds economic competitiveness in our global economy. Cuts to research funding will cost American jobs at a time when our nation can't afford to lose anymore. So what is the AGA doing, and how can you help? AGA can be found on Capitol Hill every day of the week, advocating for issues of importance to GI. The research needed to advance the practice of medicine and patient care. Through the AGA PAC, our voice is being heard. In this most recent election cycle, AGA PAC had a 95% win rate. What does this mean? Of the 56 campaigns to which we donated, omitting the 2 undecided, 53 campaigns won. This is shown in your current slide in terms of the breakdown between the Senate and the House. That means that 53 advocates for GI and medical research, in addition to many others, are in Congress, fighting for issues of importance to us and to patients. So please join us to call on Congress to take action to ensure that our nation continues to be a leader in scientific research. Mark your calendar for Tuesday, December 4th, to be a part of the first ever AGA virtual advocacy campaign. Stop the cuts. Join GIs from across the country and flood Congress with phone calls during the lame duck session. We must tell lawmakers to protect research funding, medicine, and patients, and avert a serious fiscal crisis. We need your help. Please learn more about how to contact your lawmakers and urge your colleagues to join us in our fight. For more information, visit the GI website, the AGA website, http://www.gastro.org/stopthecuts. Now, we have a few minutes to take some questions. As a reminder, if you have a question, please type it in the question pane and it will be answered in turn. If we can't get to all the questions, we'll post a Q&A online afterwards. Thank you.
And the first question that we have is, will the cuts to NIH and other agencies disproportionately affect new investigators applying for grants?
While
Okay.
it's always hard to project exactly how they will be affected, it is more likely going to affect new investigators more so than others simply because how the NIH grant process works. And keep in mind that there will be overall decreases, even including decreases in grant programs specific to those younger GIs. So yes, we would expect that the younger researchers would be affected more dramatically by the decrease in that 14% success rate.
Yes, there's a real concern we'll lose a whole generation of young researchers coming into the academic field, and so that is the greatest risk and the greatest possibility that we'll end up a generation behind in terms of our research. Thank you.
Next question. Given the pressure to prevent the fiscal cliff and to prevent the cuts to the Department of Defense because of the impact on jobs, will the medical research programs that the DoD currently funds be an easy target to cut given other agencies are also funding research for some of these diseases? Congress
will be under enormous pressure to cut funding, and so they'll be looking at various pockets, and where you can see some jurisdictional creep or ways in which they could sort of save funding and say that it's funded or provided somewhere else, it's very highly likely that that will be the case. So those programs are particularly vulnerable in these ongoing discussions.
Thank you. Next question. How can we as researchers influence Congress, and what types of messages do you think will resonate the best with members of Congress and their staff as to why research funding is important?
Yes, well, as a physician and a researcher, I think I can sort of at least give my own impression or opinion about how best to do that. I think when calling your congressman, you can talk about the direct impact of these budget cuts on laboratories in your own institution or division. In particular, I see this decrease in research funding, whether the NIH or DoD, as leading to a move by many researchers to cut their expenses almost proactively. And this, of course, would include potentially laying off technicians and postdocs. So the fact that these NIH cuts are not only affecting researchers in terms of their work, but actually will lead to actual job losses at academic medical centers, I think is a very real message and a very important economic impact of these cuts. So I would call your congressmen and senators and tell them that these NIH cuts will lead to job losses within their districts, within their communities, and I think, among other things, that will help them to pay attention to the problem.
Thank you. And as a reminder, if you have a question, please type it in the question pane and it will be answered in turn. And if we can't get to all of the questions, we'll post a Q&A online. And the next question, how will comparative effectiveness research be potentially impacted by sequestration? And will this impact the newly created Patient-Centered Outcomes Research Institute and their funding?
Thank you for the question. As you may know, the Patient-Centered Outcome Research Institute is actually funded from two different pools of funds. The first pool of funds is actually a direct tax on medical insurers, and so therefore as a tax, as it came into the account, it would be subject immediately to sequestration and the sequestration percentage. It's also funded by funding from a transfer, again a transfer from Medicare Trust Fund to sort of account for the Medicare beneficiaries that are receiving benefits from this research. And those transfer funds would actually not be sequestered because the transfer will, as we discussed, with the Agency for Healthcare Research and Quality. OMB estimates that for fiscal year 2013, the Research Institute would have an exempt budget authority of $150 million. Again, that's the money coming from that Medicare Trust Fund, along with a sequestrable amount of $390 million. Again, that's the money coming from outside insurers, for a total of $300 million sequestered at a rate of 7.6%.
Thank you. And next question, how will the sequestration impact each of the institutes at the NIH? For example, will all of the institutes be cut by the same amount, or will the NIH director have any discretion over the funding levels?
Unless Congress otherwise intervenes, the intent of sequestration is that once the percentages are determined by OMB, that those percentage amounts would apply to the same to all similarly situated sequestrable accounts. Therefore, all of the various institutes and centers would be considered similar and would receive the same sorts of cuts across the board.
Thank you. Next question. Has there been an effort to collaborate with other beneficiaries of NIH research, such as industry, who have an interest in funding for the NIH? Many patient advocacy organizations lobby to increase research dollars and wondered how involved, if at all, is industry.
At this point in time, industry is not very well involved in this discussion. But I guess the good news to that, the silver lining I'll try to find, is that oftentimes industry may not be the best advocates, given that they have other things that are kind of taking their time away, like the medical device companies are really looking at the medical device excise tax that goes to effect on January 1 as well. I would say that the important part of that is that the patients are actually involved and engaged. Just like you try to put a human face on it by talking about who you're going to have to lay off at your in your research facility because of these cuts, also being able to talk about how your research is able to help patients. A quote I like to give in this circumstance is, if you think research is expensive, try disease. So in ways in which you provide hope. I mean, that's the whole point of the research enterprise, is to provide hope to patients. And so if you can help also bolster that argument as you're going forward, it resonates well with members of Congress.
Thank you, and we have no further questions.
Okay. So thank you so much for joining us today for this AGA webinar on how sequestration will affect research funding. Please continue to read AGA eDigest and the AGA Washington Insider Policy blog for more information about the first ever AGA virtual advocacy campaign. It's going to take all of us working together to reach out to Congress to tell them to stop the cuts. To learn more about AGA's advocacy efforts and to listen to the archived presentation, please visit our website at www.gastro.org. Thank you.